Hello everybody, welcome again to my YouTube channel. My name is Iriarte and today I'm going to talk about the posterior side of the knee and its ultrasound evaluation. We just saw the anterior, the medial and the lateral side, and now is the turn of the posterior side. In this area I divided it in three areas: the posterior medial side with the posterior cartilage and joint line, the posterior horn of the medial meniscus, the tendon of the semimembranosus and gastrocnemius medialis, and the bursa between these two structures, and finally the PES Anserinus, which distally has a medial insertion, but as we go proximal it becomes more posterior. In the lateral side, again, this is the lateral cartilage of the lateral femoral condyle, the lateral meniscus and its posterior horn, the biceps femoris insertion, and the external gastrocnemius tendon with or not with the fabella, okay? And in this side we can also check the common peroneal branch of the sciatic nerve. Finally, on the central compartment we can see the plantaris and the Popliteus muscles, the distal PCL, a very small portion of the distal PCL can be seen with ultrasound, the sciatic nerve and its tibial branch, and finally the popliteal artery and veins. All these structures can be seen with ultrasound. So let's go with the posterior medial side. In this image you can see the cartilage and its posterior side of the cartilage and the posterior horn of the meniscus. And about tendons, what about muscles? The gastrocnemius medialis is located here, and very important to notice that the muscle is slightly central, but the tendon is medial. Okay, this is medial, this is lateral. Okay, so this is the tendon of the this tendon is a tendon of the gastrocnemius medialis. As you can see here, it has a boomerang-like shape, which helps us to locate this tendon in this area. This structure is very close, has a close relationship with the tendon of the semimembranosus muscle. This tendon is a very thick and with quite strange anisotropy, because it's not a constant tendon with different anisotropic images inside, and it's quite difficult to have a good view with ultrasound, as we are going to see just later. Okay. Between these two structures, this is an image of the long axis of the semimembranosus and the gastrocnemius medialis. As you can see here, the anisotropy, the direction of both tendons is different, so the anisotropy will vary. So this is an important detail to take into account when we are performing the ultrasound. Between these two tendons there is the bursa, which usually is empty, but sometimes it can be a small amount of liquid can be present without implying pathology. And if this bursa has liquid inside, this is called the Baker's cyst. Okay. Finally, above the semimembranosus we can find the tendon of the semitendinosus. Okay. And let's take a look at the images. This is the MRI. Let's zoom it. You can see here the condyle and the tibia and the meniscus between these two structures, and this is the probe located in the posterior side. Now let's take a look at the ultrasound. So this is the cortical of the femur, this is the cortical of the tibia, the cartilage of the posterior condyle and the cartilage of the tibia, and between these two structures in the joint line, this is the posterior horn of the medial meniscus. Always, as I always say, don't try to assess meniscal tears with ultrasound. It's not enoughly accurate. You need to ask for MRI. Okay. Now, what about the semimembranosus and gastrocnemius medialis tendons? You can usually go from distal to proximal, from the gastrocnemius to proximal, or from proximal to distal. I personally prefer this second method, and I usually place the probe in the medial, in the distal side, in its medial third here, in this short axis. It's very easy to locate this structure here, this round-shaped muscle big muscle, which is the semimembranosus. Okay. If we put the probe here, we will not obtain this image here with this oval shape or round shape muscle, big muscle, and with this small tendon just above the muscle. This is the semimembranosus and this is the semitendinosus, semimembranosus and semitendinosus. You can notice here this aponeurosis here in the medial aspect of the muscle, which is the aponeurosis of the semimembranosus. What happens when we move distal? Then the muscle becomes smaller, okay? Like you can see here, there is still the semitendinosus above and the aponeurosis thickens, okay? And if we continue distal, then the muscular component finishes. We are here. And notice this strange shape of this tendon, very thick, with this like two components, very easy to see in the MRI, and so is in the ultrasound here, with different anisotropy usually. This is this thickened blur area here, not very detailed, not very clear. This is the typical image of the tendon of the semimembranosus. So that is why you need to follow this structure from proximal to distal. Once you do this technique, it's easy to locate, okay? And if we follow this tendon, we will notice this structure that appears here, slightly lateral. This is lateral, this is medial. And this muscle is the gastrocnemius medialis, okay? And this is the tendon of the gastrocnemius medialis with this boomerang-like shape, okay? Between these two structures here, to avoid friction, there is the location of the bursa. Okay? In this image, the bursa is empty and we cannot see it. And in this image, you can see a small amount of fluid inside the bursa. It's also interesting, this image, because if we have a bright image of the semimembranosus tendon, about the gastrocnemius tendon, this is a not very good image of the semimembranosus. But if we fan or we tilt the probe, we will have this brighter image of the semimembranosus, and the tendon of the gastrocnemius becomes darker here. Okay, don't forget that the gastrocnemius tendon and the semimembranosus tendon have different directions, so the anisotropy is different. So it's very difficult to find both tendons very bright. Okay, when one is bright, the other is dark. Okay. And if we continue following the semimembranosus tendon, we will arrive to the tibia and its insertion here in this small fossa in the posteromedial side of the tibia. If we turn the probe 90 degrees and we put it in the long axis, you can see here this small fossa in the posterior side of the tibia, and this is the typical insertion of the semimembranosus on its long axis with these two components, usually very easy to distinguish inside the tendon, and its insertion here. Okay, the insertion of the semimembranosus is very complicated with 5 components, but it's not the purpose of this lecture to talk about the 5 components. It's only a simplistic view, but it's enough. Okay, and this is the image of the gastrocnemius medialis. Here is the muscle, and this is the tendon, and this is its direction towards the medial epicondyle. The insertion itself is difficult to see because the direction is deep, going deep, so it's difficult to have a good view in the insertion with ultrasound. Okay, and let's go to the PES Anserinus. The PES Anserinus, as you know, can be seen proximal, and we repeat the same image, the same level we have just seen before, and this is the round muscle, so this is the semimembranosus. Here you can see the semitendinosus here, and there is another muscle just anterior. This is anterior, this is posterior, okay? So this is the gracilis muscle. This is the semimembranosus, this is the semitendinosus, and this is the gracilis. Okay, a small reminder about the PES Anserinus. There is a mnemonic to remember this position, the location of its components is say grace before T. Say of sartorius. This is anterior to posterior. Sartorius. Grace gracilis. And T semitendinosus. So sartorius, gracilis, and semitendinosus form the PES Anserinus. And the semimembranosus is not a part of the PES Anserinus and is usually between the gracilis and the semitendinosus. Okay, always bothering just in the middle between these two tendons. Okay, don't forget semimembranosus is not part of the PES Anserinus. If we follow these structures distally, we can see now there is no more muscle here. There's no longer muscle here. This is the tendon of the semimembranosus. So this tendon here is the semitendinosus. This tendon here is the gracilis, and we can still see here the sartorius with its muscular component. So this is the semimembranosus, and this is the PES Anserinus. Say grace before T. Okay, so a mnemonic is useful, I think. Okay, and finally we follow distal. Then this is another image with the sartorius with a very mild component, mild muscular component here, the gracilis and the semitendinosus. This is anterior, this is posterior. Okay, sartorius, gracilis, semitendinosus, and there is no more semimembranosus because its insertion is here, so it has just finished at the tibia. Okay, so there's no more semimembranosus. Okay, so that was the medial side, the posteromedial side of the knee. Now let's go to the posterolateral side of the knee. Again, we can see the gastrocnemius, in this case the gastrocnemius lateralis here, okay, and the biceps femoris. So let's start with the biceps femoris. You remember the biceps femoris has two heads, long and short head, and both they come together and insert in the head of the fibula. It has again a complicated insertion with 4 components, but we are going to simplify again the insertion, and we are going to talk only about its insertion in the head of the fibula. The gastrocnemius lateralis, with its insertion in the upper side of the lateral femoral condyle, and the plantaris muscle. The plantaris muscle shares more or less the insertion with the gastrocnemius lateralis, okay, but the body of the muscle is in the posterocentral compartment, so we are going to talk about the plantaris in the posterocentral compartment. Okay, this is the plantaris muscle. And finally, the common peroneal nerve. This is the branch. This is a branch of the sciatic nerve. The sciatic nerve gives the common peroneal nerve and the tibial nerve. So the common peroneal nerve gets lateral, and we are going to assess this structure just later. Okay, so the joint, again, as we have done in the medial side, we can put the probe in the same direction and see the posterior cortical bone of the lateral condyle with its cartilage, the tibia, and the meniscus. The lateral meniscus is even more difficult to assess with ultrasound than the medial one, so it's not very useful to check the meniscus. Okay, but it's here. Biceps femoris is easy to check with ultrasound. If we begin slightly proximal, we can see this image, a very clear image, with these 2 components. The quadrangular component is the short head of the biceps, and the trapezoidal component is the long head of the biceps. Okay, very important to assess very accurately this structure here, this fascia between these 2 components, because usually the distal injuries of the biceps femoris will be located usually at this place here. So very important to very accurately assess this structure here. As we go distal, we can notice how the long head of the biceps is getting smaller, and there is still a good amount of muscle of the short head. more distal, there is no more long head of the biceps, and there is still the muscle of the short head of the biceps. And finally, if we follow the tendon, we will notice how it inserts in the head of the fibula at this level. Again, we must check the tendons in the short axis and the long axis. So this is the long axis, and you can see here the fibula, the head of the fibula, and this is the tendon of the biceps femoris. The tendon of the biceps femoris can be checked from the lateral side or the posterior side. It doesn't matter. And we can also check the tendon of the gastrocnemius lateralis here. And notice that we have this image here. This is not a calcifying tendinitis. This is the favela, a normal ossification inside the tendon. Okay, and don't get wrong thinking that this is a calcifying tendinitis or some kind of pathology or a loose body. This is the favela. About the common peroneal nerve, if we begin, this is a mistake. We must start here at the sciatic nerve, at this level, and we will see this image with the sciatic nerve just between the long head and the short head of the biceps femoris here. And if we follow this structure distally, we see its division on these two branches, the lateral one and the medial one. This is the common peroneal nerve, and this is the tibial nerve. Notice that the biceps femoris is located here with the short head, and this small amount of muscle of the long head. This is the tendon. If we follow the peroneal nerve, we can see how it goes superficial, always following the biceps femoris. Very important, the common peroneal nerve will join the fibula. As we can see, if we go distal here, this is the common peroneal tendon, and this is the neck of the fibula. So, as you can see here, the common peroneal nerve gets very, very superficial and between the skin and the bone. So this is a potential area of damage of the nerve. So it's very important to check the nerve at this area here. Okay. Once we are here, then the nerve goes through from posterior through lateral, and it comes from here to here. This is posterior and this is lateral, and the nerve passes through this area to the lateral side of the leg. Okay, and this pass-through is underneath the peroneus longus muscle. This is the peroneus longus muscle, and the common peroneal nerve has passed from here to here underneath this muscle, and this is here the common peroneal tendon. And after this pass-through, it divides into its two terminal branches, the superficial and the superficial branch and the deep peroneal branch here. But this is subject for another lecture. Okay, so it's very important to notice this changing of position from posterior to lateral, and this pass very, very superficial in this area, very dangerous area to the common peroneal nerve. Okay. And what about the PCL? Now we are in the posterior central area of the knee. The PCL is not accurately evaluated with ultrasound. We can only see its distal insertion in the tibia. Once we are performing an ultrasound scan, okay, we will take a look. Okay, some cysts may be seen, and sometimes some injuries of the distal third of the PCL can be seen here. Okay, but we don't have a good view. Always check the position of the probe slightly from distal to proximal, slightly from lateral to medial. Okay, not so exaggerated like in this image. Okay, but slightly from lateral to medial. Okay. And the muscles of this posterior side, the popliteus and the plantaris. The popliteus is very, very deep and very close to the cortical of the tibia, of the diaphysis of the tibia here, okay, metaphysis of the tibia. So it has this triangular shape, and its insertion, as we have seen in the lateral side, is in the lateral epicondyle fossa, popliteal fossa here. Okay, but the muscle is posterior, very, very deep, and underneath the popliteal artery. And the plantaris, as I have told just before, the muscle is in the medial, in the central compartment, but the insertion is just above the lateral condyle. This is lateral, this is medial, okay, lateral condyle. And when we are proximal, it's underneath the gastrocnemius lateralis. Okay, and to see these structures with ultrasound, we can place the probe in the central aspect of the knee, slightly distal, and we will search the cortical of the tibia here. So it's very important to put low frequencies and to go very, very deep with the parameters of the ultrasound machine, because we need to locate the cortical of the tibia very, very deep. And underneath the popliteal artery, we will see this muscle here with this oval shape, with this intramuscular tendon here, and this will be the popliteus muscle. This is the image, the cadaveric image. And to check the plantaris muscle, I recommend this technique. Usually we put the probe more distal, we locate the gastrocnemius lateralis and the gastrocnemius medialis. This is bigger than the lateralis, so that's why I know this is the medialis and this is lateralis, and the soleus muscle below. Then we go proximal, and we will notice how a triangular muscle appears between these three muscles. This is the soleus, this is the gastrocnemius medialis, and this is the gastrocnemius lateralis. So this triangular shaped muscle is the plantaris muscle. Once we have located this image in this short axis, we can turn the probe on its long axis, and we will notice this image here, which is the plantaris. It's not always easy to see the plantaris, okay, but usually with this technique you will find comfortable. This is the gastrocnemius lateralis, this is the soleus, and this is the plantaris. And to finish the neurovascular bundle, we can find here in this position on depth the popliteal artery, just above the veins, usually one vein, but sometimes you will find several veins, okay, the popliteal vein. And finally, superficially, the tibial nerve. Remember that sciatic nerve has two branches, the common peroneal nerve, which goes lateral, and the tibial nerve, which continues in the central area. And is superficial to the neurovascular bundle. Artery, popliteal veins, and finally the tibial nerve. With Doppler, we can check these structures, and finally artery, vein, and tibial nerve. Okay, and that was the posterior side of the knee. Not so terrifying now, okay? I hope you enjoyed the video. If you have any question, just put a comment below, and I try to answer your questions. Don't forget to check the like if you like the video, and don't forget to subscribe if you want to be informed about new releases. Thank you very much.